What do we do if the fluid around the heart contains a lot of blood? I had a patient like this recently. I'd managed her after we'd found out that there was fluid in the sac around the heart. When we drained that fluid, I was expecting it to be clear. In fact, it wasn't. It contained a lot of blood. When we find something like that, it's a concern because there's something very active going on that's creating that problem. So we need to look for the potential causes, and they are different from the usual causes that would create straw-coloured fluid around the heart. When this is not traumatic, so from say surgery or trauma, then we need to look for things like causes of inflammation, perhaps infection. Viral illnesses and pericarditis can sometimes produce this. Even things less common, at least in the Western world, like tuberculosis, could cause this bloody effusion. Then we also need to think about autoimmune diseases, and lastly, we need to consider cancer as a possible cause. Now, this is not necessarily cancer of the heart, but cancer perhaps of the lung or somewhere else that has spread and caused this problem in the linings, either of the lung or the heart. So in this particular case, we've obviously done lots of tests, including blood tests, CAT scans, and we've drained this fluid and we've sent that off to the lab to try and understand better why there is blood around the heart. Hopefully that gives you a little more insight into what might cause effusions. This is obviously more on the more concerning side than when it's just the straw-coloured fluid that might come with something like heart failure. I will update you if we find out the answers.